So today I'm going to show you how to dissect the lower limb of the cat. Now, one of the things I did show you is how to do the abdominal muscles. I'm actually going to do it again so you can see how it actually can open up here. And I'll just do this quickly. And the abdominal muscles. The importance of this is you can actually see the three layers. Now, one of the things with the abdominal muscles is they are relatively thin, especially on a cat. So you are going to want to be a little careful. Now, over here, you can already see the external oblique, which I separated out just by using blunt dissection. Again, what you want to do is find the line, put the scissors flat, and open it up. You can end up then going into the internal obliques. Again, same technique. Find the line, open, and as soon as you are in, as soon as you find the opening and get in, so here you can actually see where I'm separating out the internal obliques from the transverse abdominis. You may tear a little bit of the abdominal cavity. It happens because of the thinness of the muscles. But once you do that, once you actually know what you're looking at, you can cut the fascia a little more, and you'll have an easier time being able to separate all three muscles. Now, by doing this like this, what you will end up eventually having is, and this is the one place I am cutting, the reason is more to show you the three layers. Now, once you do this, you now can see the internal oblique, the internal obliques, external obliques, and underneath it, the transverse abdominis. So you have all three of them here now. Now, when you're doing the lower leg, what you do want to do is look for the lines of muscles. You can see over here you have the sartorius, the adductor longus here. And so we are going to start with the femoral triangle. Now, you'll notice that I'm, again, always looking for a line, such as here, and opening it up. Now, once you open up the line, a lot of times you can then put your entire tool in there. So you put your tool in the cat and just come out. Now, if you can see that, all you're going to do is cut fascia. You can then just cut the fascia, and you can see the muscle a lot more. And by separating out, you end up seeing how you can separating out. You can end up seeing the muscle and the structures around it. Now, here you can now see the adductor longus being separated out completely. All I did is I separated this out, which is the adductor longus, and you can now see how it runs this way, causing the adduction. In the sartorius muscle, you don't have to remove all the fascia like I'm doing. I'm doing it more to show, but what you can do is, again, you put your scissors flat, you see a line, you open up around the line, and what ends up happening is the muscle starts showing up. It is important to notice this. The more time you spend doing the muscles, cleaning them out, making sure they look right, the easier the rest of the dissection is going to be. So for instance, when you get into the cardiovascular system, which is next, the more work I do dissecting these muscles, the easier it will be for me to find the arteries, veins, and eventually even nerves, which you can already see some of the nerves. You see the artery here, vein, you can see the nerve coming down here. And so, as you come across, different structures, make sure you do the blunt dissection so you don't cut anything. The nice thing about this is you can see how fascia tense and how easy it really tears open. A lot of people make the mistake of only using the scissors. You really want to put your fingers in there and separate everything out. Once you do that, it really becomes a lot easier, a lot quicker, and you don't spend as much time trying to tease certain things out which really don't mean that much. Again, you'll notice that I'm using actually the blunt ends of my scissors to tear out the fascia. Now, once you've actually done this, you can now end up seeing the sartorius really well here. And all you have to do is take your finger, run it up and down, then you can see the muscle here. Now, in humans, you'll actually note that it is a bit, it's a lot longer, and so it doesn't actually work. I actually tell people to cut it mid-belly. So this way, when you put it like this, you can see that it was once a muscle on its own. And as we open this up, we then can end up finding the quadriceps muscles here. Again, what you want to do is you see the fascia, you see the line, pop your scissors in, open, and once it's open, you just want to go in and clean everything up. Now, once everything's open and clean, you're going to want to do something else. What I'm actually showing you here, which is the quadriceps muscle group, and this muscle here that I'm cleaning out here would be vastus medialis. On the other side of this would be the on the other side of this right here in the middle, you can actually make a hook with your finger to free that muscle a bit more. Now, I actually did try to find a cat that I thought was going to be problematic. Ironically, it ended up not having many problems except for the tendons being really tough. So here you can now see the tensor fasciae latae. You can also see the rectus femoris coming here. Now again, with the rectus femoris, I do want, if you're in my class, I do want you to clean it out. And once it's clean, once you've done this, and you can get your finger all the way around it, you can then, and only then, don't do it before you can see your finger on this side, on the other side. See how the scissors can go through? You're then going to cut it in half. Now, I would actually usually tell you to do one side superficial, one side deep, and if you make a mistake on the deep one, then you can actually do it again. But the reason you want to do this is now you can end up seeing the vastus medialis, vastus lateralis, rectus femoris, and deep you can end up finding the vastus intermedius. So you've actually just done the thigh of the cat. You can go deeper in here, you can separate more of these muscles, and you can find a lot more structures. I'm not dealing with structures again, I'm dealing just a how-to. Now, if you come to the back of the cat, we're going to turn him around this way, you actually will notice that the popliteal fossa is relatively easy to find. Popliteal fossa, remember, it's where the muscles come together to form the back of the knee, depression in the back of the knee. So again, you just pop your scissors in, open it up, and blunt dissect out upward. Now, one of the things, again, use your fingers when at all possible. Sometimes you'll actually run into something that I'm running into right here, and that's a really tough fascia. Make sure you can see your finger from the other side. Don't cut unless you can see what you're cutting. And from here, you can, even though I tell students not to do this, I don't want them to rely on, I don't want you, especially if you're my student, I don't want you to rely on it too much. But sometimes you do have to cut the fasciectomy. And now you can see the back. You can see the semitendinosus here. You can see the membranosus underneath. You can see the biceps femoris, and you can continue this to do the Gastrocnemius Soleus, all the muscles that you normally would want to find in your human. You can find them or a version of them in a cat. So here you can actually now see the gastrocnemius, the soleus being underneath. Again, it's just doing the same technique that I was showing. Now, one thing that a lot of people do have a hard time with is the forelimb. And for that, I'm going to actually use the anterior portion. Again, it's just the same technique. You find a line, you put your scissors inside, and open. Like I tell people, there's a lot of videos on how to name the cat all the parts once you look at it. So I'm not going to be doing that at all. I figure there's no need to. But the techniques, I've noticed that very few, if any, videos show the techniques the way I like them. So again, it's just popping it in and cleaning up. When you get to the forearm, it's actually a lot harder. So pinch, you'll see it tent up, pop, and open. Now, here you can, again, once you know it's just fascia, just cut. I always, again, tell you guys not to cut for my own reasons, which is not to make it go slower, but a lot of you don't know necessarily what you're cutting. And so, until you know that there's nothing there that you're going to want to look at, don't cut. Once you know that there's nothing there, then you can cut. Now, the nice thing about this cat, the cats that I use at the school I teach at, is that they're injected to show the arteries. And so after I remove this fascia, I will start to cut the way I like to get into the chest. Now again, I'm not trying to do all the dissection, mostly because there's enough of once you actually understand the techniques, you can actually go through it, and you can go through it quick, and you can find muscles that maybe either not on models or may actually make it more understandable by finding them in a cat as you dissect out every aspect of it. And so you are going to end up finding all the muscles of the forearm. You can already start seeing them pop out. And so that's all you're going to do is come in, clean out, see the muscle, and determine what it is. Now the next video I'm going to show you how to do the abdominal cavity for the heart and blood vessels. Hope you'll stick around, and hope you are learning what you need to know. Hello, it's Dr. Rafael Gutierrez again, and today I'm actually going to tell you a little bit about the skeletal structure and how it is used for the heart. Now, big thing is always remember, go back to the bones whenever you do anything. Doesn't matter if it's bones, muscles, cardiovascular, nerves. The skeletal system will give you a lot of clues for it. Now, what I actually want to tell you is how the stethoscope is used. And one of the things, by using Yorick, you can see certain things that happen. Usually if you go to a clinician, they will listen to your chest. Sometimes they will actually listen to different areas. And one of the things people forget is why they're doing certain things and how. Now, one of the first things that happens is most people can actually eyeball where it is, but a lot of people will feel the sternum, especially this area here, known as the sternal angle, and go lateral. And what they find is they find the second intercostal space. So if you have your first rib here, this is the first intercostal space. Second rib here, second intercostal space. Right here, on the right second intercostal space, you can hear one of the valves. Now, one of the things that happens is the heart kind of rotates on itself, and the arteries switch. So you actually hear the left side on the right side of the heart, and the right side on the left side of the heart. The arteries are switched. So over here on the right side, you'll actually hear the aortic valve. Here on the left side, you'll hear the pulmonary valve. And you can end up coming around here, and you'll end up hearing the different valve sounds. Now, usually what you're looking for is a 6 intercostal space. So you have the 1, 2, 3, 4, 5, 6. So around here is where you actually want to hear. You actually will be able to hear one of the heart sounds. So that is actually how you're going to use the rib cage for cardiovascular system. There's a lab in my little human anatomy, the clinical approach, which we talk about that because it is one of the things that's important when you are listening to heart sounds. Make sure there's no valvular regurgitation.